So it becomes then indeed very difficult for all of us to look and say, we just can't abide by this, even though some people some lives might be saved among all those many thousands that are dying now every year. But whatever passes through this mess, we are going to have a lot of work to do as single-payer advocates. I think we all know that. We have a lot to build on over the last couple of years, but I think there are some things that are going to be critically important as we go forward. One of the things I think we can take great pride in, and I think that is largely due to the educating efforts of people like Katie Robbins and Healthcare Now, and PNHP doctors like Margaret Flowers and Dr. Fine, and certainly Quentin Young and Walter Sue, and so many of your other stellar docs, and Len Rodberg, who I am very fond of as well. Go out and speak to people about single payer in a way that's clear, that makes people understand. We've moved past George Lakoff, haven't we? That is a great victory on all of our parts. They certainly know what the word single payer mean now. We didn't have to redefine. We didn't have to retool everything, and I think we can be very proud of that. We've not only saved ourselves a lot of consulting dollars, but now we can move on to some more important issues. I think that education process has to continue, but it has to change a little bit now. It has to develop not just the single payer message as we explain more and more to people and dispel the myths that people have had, but now we have to concentrate on why we all stood so critically against some of the parts of the legislation that it will pass or not pass, whichever way it goes. Because as we know, the implementation phase of this legislation, even the parts of it that might have limited help, some of it's so far off in the future that we still have time to let people know why the doctors of PNHP were critical of the legislation, why the nurses in our organization were critical, why Healthcare Now's membership came out against the legislation. We need to educate people why, so they don't feel like we're in the circular firing squad trying to tell other people who are wanting to try and do some good things with healthcare, because there are some of those people involved who are fighting for this particular legislation. We need to explain that and educate on that, and to start working right away to make a better environment, to make, if something passes, to make it stronger and make it more like what we want it to be. And if nothing passes, then we have a prime opportunity to go back to the drawing board and not let it be a generation before we take any more action. I personally completely dismiss that notion anyway, that it's going to be a generation before we take this up again, because I believe David Himmelstein's predictions. I believe Steffi Woolhandler's predictions that if we don't stop what's going on right now, it won't be very many more years at all before we've created an even more dire situation, not only with healthcare cost, but with the numbers of people in this nation who can't access much care at all. So I trust that those predictions are correct, and that the generation from now, if we do nothing, would be just so grossly affected that we wouldn't let it get to that point. So we have a lot of work to do immediately. We have to start working. The other thing that's going to happen before implementation of most of the implementation dates of this legislation, I think we're seeing it happen right now, no matter what happens in Massachusetts today, whether or not Brown wins or Coakley wins, the Democrats are getting a little comeuppance today. And it's almost a little bit sweet that it's in Massachusetts. I mean, I don't like to say that, but it's interesting that it's in Ted Kennedy's seat, isn't it? That people are feeling so strongly about this. And I don't believe they'd be having this problem if they had stood firmly for a single-payer position. I believe it'd be very different if they had stood firmly for real health care justice. So they have a real risk now, not only of losing today, but of losing the majority in Congress in 2010, of losing the presidency perhaps again in 2012. How unthinkable is that when Barack Obama was elected a year ago with such an overwhelming drive of support from the American people? It's kind of stunning that they've squandered that amount of political capital in this amount of time, and I don't feel good about that for them. I think if they had stood strong for what many of us knew was right to do, and what even Barack Obama knows the right thing is to do, we wouldn't be having this kind of discussion tonight. It just wouldn't be occurring. I think it was politically inelegant and foolish the way they let this transpire, myself. So they stand to lose the majority in 2010 or 2012 and 2014, and then what may happen to whatever they pass? A lot of people predict that either it will be seriously weakened or completely repealed before the major parts of it are even implemented, which in itself would be quite something for this country, wouldn't it, to have fought for health care reform to get this terrible bill and then have it be repealed by a Republican majority. It would be very odd. So we have work to do, and what do we do about that as people who believe in health care reform? I think our only real answer is, I think that the political approach going forward, and I know PNHP docs are going to do a lot of educating, and that's so critical, but the political approach has to be on several levels. It has to be on, number one, the fight for single payer on the state level. We have to turn a state to a single payer state. I think once we can demonstrate that for the nation, how well it can work, and how pleased the people of a state would be to have a single payer system, it will tumble forward into other states. I think California is probably still the closest. Pennsylvania is doing an awful lot of work and a lot of hard work on it, but there are lots of other states, we all know, that are working on single payer. We've got to win one of those. We have to win one. We have to recruit and elect single payer candidates. We simply have to. And if we have, and we may not like this, but we may need to pick a couple of races in strategic places where people we thought were our friends in single payer, who didn't turn out to be our friends in single payer, that we run someone against them who is single payer and send a message. I know that sounds kind of harsh, and sometimes we may not like to do that, but we may need to send that kind of a message. Pick a race, be smart about it, pick one that we think we can make a difference in, and send a very strong message to every other candidate in this country that if you don't do what we elect you to do, which is to support single payer, we could run someone against you and you could lose. We need to send those kinds of political messages, and we don't have to do it in every race. We can choose one or two and do it. We need to elect more doctors and more nurses who are single payer advocates. That we could do. We can recruit candidates and get those people to run in offices in states and run on the national level. We can do that, and we can help support them and help get them out there. The two other fights that aren't related truly to single payer are related to our success at every level going forward, and we've all talked about these before, is the fight for campaign finance reform and the fight to change how the Senate does business. Thank you, I like that. That's nice to hear applause. But we all know that those two issues this time have just completely overrun any meaningful discussion on health care. Has been overrun, number one, by the purchase of our United States Congress and the presidency by the health care interests in this country. We all know that. And secondly, by the fact that the Senate rules are so awful that you have the conditions that we see now, where they have to have this supermajority, where we watch that. I know many of you did, like I did. If you didn't watch it unfolding live, you probably watched it later with Bernie Sanders trying to bring up the single payer amendment in the Senate and being cut off by this god awful long, having to read the entire amendment, 700 pages. And God love you, Katie, and some of the people in New York who were going to read it anyway in the park. I love that.